Greetings, everyone. It's Friday, January the 22nd. Boy, January is moving along pretty close. It's not going to be long for Valentine's Day is here. I do love holidays. I'll write a bit to update you on today, though. I'm going to go as fast as I can, but there's news around our vaccine deployment, testing, and some just general Care South Carolina news and updates. So, first, let me talk about the vaccine. Through yesterday, now that actually doesn't necessarily include today because things are still happening in vaccination, but through yesterday, we had vaccinated 207 folks. 134 of those were staff. Kudos, good job. Kudos to all of y'all. Now, and when we add that to the number of staff that got, staff and volunteers that got vaccinated previously, that brings our total, we think, around to 205. And we've got some staff that have actually had COVID, and they are really holding off on their vaccinations. They aren't prohibited from getting vaccination, but they aren't really a first priority. So we've really got a quite good number of staff that are moving forward in their immunity, so to speak, against this horrible plague, the coronavirus. That is a breath of fresh air. I got my second vaccine, final vaccine today, this morning. So, quarterly risk management, I'm really sorry I couldn't attend, but I had to go get my second vaccine. I got it in my right arm this time, and I'll take the Tylenol. And if I've got any soreness or what have you, I'll keep y'all abreast of this on an ongoing basis. But last time it was a piece of cake. I mean, I might have had soreness for a day or two, but it just wasn't anything to speak of. So this is rapidly moving along. Now, you might know that we had been promoting our vaccination plans via our webpage and also Facebook. And we have been saying that next week we were going to be moving to making appointments for our established patients, those who are 70 and older. Um, we are, and we, there were a lot of appointments made for that. I think we had a total of like uh, about 47% of the appointment slots that we had open have gotten filled as of yesterday. That doesn't even count today. So we've had a pretty good response from that, but it's pretty obvious with the fact that 13 of our sites got a shipment of 200 doses. We still got a lot of vaccine. So next week, two things are under development. Number one, we're going to be opening up the vaccination opportunities for anyone. I repeat, anyone that is 70 or older. Now, we will continue for those who are in 1A, those staff that are actually in 1A. Um, Hold on, let me cut this off. There you go. Thought I had silenced that, but I didn't, obviously. But we will continue for those that are in 1A, like our own staff or any other healthcare partner staff, to provide the vaccine to them. But they'll have to get in line. They'll have to find an appointment. Now, about appointments. We've given a lot of thought to this. We do have right now 13 sites that are eligible. In other words, they're registered as sites on the DHEC registry. Uh, what we're thinking is that it might be better for us to be able to actually hold our vaccination clinics, so to speak, in a centralized location in each county. So, in other words, Dillon County would have a location, which at this point is looking favorable that it would be Latta. Marlboro would have a location, which at this point it's looking favorable that it would probably be McCall, and so forth. That really will help us because what we're finding as we're running into this is the big barrier on being able to vaccinate folks is not the supply of the vaccine, but instead it's the shortages that we have in staff for one reason or another, either quarantine or normal absences or so forth. So, what we're really trying to do in our vaccine task force is create vaccine teams that can really focus on one location on a regular schedule within each county and be able to put out a lot of vaccines at one time. That plan is still under development, but I think we'll be able to roll that out pretty quick, um, at least from every uh, aspect that we're looking at. You know, DHEC and the Labor and Licensing Board have really made some big strides recently. Dentists are now approved to give the vaccine, and our dental team has stepped up. They are really very willing to play a role in this and to be part of the vaccinator teams. Um, RNAs and some of the other certified and registered medical assistants are also being approved. Of course, pharmacists have always been approved. They can be checked off for immunizations. And then, of course, we have LPNs and RNs, a lot of our wellness nurses and the nurses that provide our Medicare wellness visits are also going to be able to be deployed in this effort to really get a plan together so that at least every county can have a pretty amazing vaccine clinic. So stay tuned. We will be publishing this as we always have on our webpage and through Facebook. There is a huge demand just for the 70 plus year olds for vaccinations. We do hear from the governor's office that there is going to be some future options for parents of children that are medically fragile to also be on this first wave of vaccine. And we'll wait and see what those criteria are going to be. But, you know, the point is we need to get vaccinations out. Now, as I've said many a time, uh, there's only a small window of opportunity. Once that vaccine vial is open, and there's usually around 10 doses per vial, we only have 6 hours to give it out. I'm really sorry to report that we actually ended up in one of our sites wasting 4 doses. Two of our staff backed out at the last minute, and we didn't have time to reach out to anybody else that wanted the vaccine. That's a sad commentary because that means that 4 people that really wanted the vaccine haven't been given that opportunity. We've done much better. We've kind of gotten our act together a little bit better since then. We haven't wasted any since that first day. But rather than waste the vaccine, we are asking that sites actually create a waiting list. They don't have to, on the waiting list, you don't have to be necessarily 70 or older. You just have to be able to respond to a call should we have leftover vaccine quickly within 15 minutes so that we don't waste any vaccine. And staff, if you've registered for the vaccine, please don't back out. It's really important. We need to get you vaccinated so that we can continue our services and continue the mission that is really at our very heart. Um, and unless we can get over this plague, this coronavirus, we're going to have a real struggle to do so. So, like I say in all of my emails, don't wait, vaccinate. We are going to be using all of our vaccine. And you know, at one time I had talked about that we would hold on to our second doses because we were really concerned. Uh, Prior to these past couple of weeks, second doses have been a problem. The vaccine supply has been a problem. But now it is pretty well confirmed and very clear, especially under the new guidelines of the new administration, that CDC, whenever we order like 2,000 doses or what have you, that those second doses will be available to us within a month. That's the wait time for the Moderna vaccine second dose to be given. So I, we have to comply with what the governor's Andy Hicks expectations are. So we're going to vaccinate as many as we can with all of our supplies. And I'm confident, I have a great degree of confidence that those second doses will be available. And that is, even though we do know that that's been a problem in the past, there's new days that are out there. Um, in other issues, around COVID. Testing, of course, is going to continue. We've still been doing a right good bit of testing. Many of our sites have been able to do drive-through testing. Thank you. And of course, we've got the Mobies that are going out. We had a little bit of a delay with some of the Mobies. We had to get some of them in the shop for a few upgrades and repairs. But we're getting back in the swing of it, and testing still remains as a priority. We do a lot of Moby testing in the counties at churches and at community centers and so forth, and we're really going to be able to continue with that. Right now, we have the fewest staff that are on quarantine either because they tested positive or because they had an exposure than we've had in quite a while. Thank heavens, because this is the time when we really need all the staff we can get as we're moving in vaccine deployment. But that's good. That's good. From um, our conversations on the task force on Wednesday this week and today, we only had one other employee that had tested positive. So let me tell you, that's some really, really good news. The infection rate in our community still remains high, although it does appear to be slowing a bit. Now, the impact that the prior infection rates and the prior positive number of cases have had in our local communities is still going to have an impact on the hospitalizations and sadly on the deaths. Uh, I'll tell you, if you personally haven't been impacted by someone close to you or someone that you know, either friend or family, that's died from COVID, it's a terrible thing to experience. I recently had a very close friend whose brother that I knew recently passed away, and folks, that hits home so very hard. We need to do everything in our power to get this coronavirus pandemic over with as soon as possible. Vaccinating, doing the things that we've talked about now for almost 10 months or over 10 months, wearing our mask in public, keeping our distance socially, 6 foot, um, making sure that we maintain every single infection control procedures that we possibly can. Hand washing, using hand sanitizer, everything. We have got to keep that up even if we have been vaccinated. It is not over with. So we need to keep on our guard. This needs to get over with. Uh, I do have some other good news though. Many of you may have heard of a treatment that has recently been talked about. It's called the monoclonal antibody treatment. That was earlier, several months ago, still under experimental nature, so to speak, but it has recently gotten FDA approval. And FQHCs are really being asked, even I might say begged, to be stepping up to render that monoclonal antibody treatment. This is a very good treatment. It seems to be able to reduce the severity of the coronavirus and even prevent hospitalization and death. There is a small window of opportunity. that a person, once they are diagnosed and are a candidate for the treatment. I'm certainly not clinical. I don't want to spread any misinformation, but the window of opportunity, I think, is between 7 and 10 days once that positive test has been received. High risk patients are those who are targeted, which for us, frankly, means our HIV patients that have tested positive, patients with hepatitis C, and a myriad of other high risk patients. We are going to be working with DHEC, the Primary Care Association. We're going to be learning some of the best practices and guidelines even that MUSC has developed. And we ourselves are going to be soon providing the monoclonal antibody treatment at our infusion location over in Hartsville. It has to be rendered by IV, and there is a time estimate of about an hour that it takes for the infusion, and then there is an additional wait time. So that's about as clinically detailed as I can get, but I am also so very excited about this. I want to do everything we can do in our power because we are in communities that normally aren't available. Monoclonal antibody treatment has been available in hospitals, but hospitals aren't exactly gung ho around providing services to uninsured patients, especially expensive services like this treatment is. So we will be able to bridge that gap, reaching out into communities that otherwise would not have access to this new and very exciting opportunity. So stay tuned for more. We're not quite ready to promote it because we haven't been formally approved yet, but it's in the works. Uh, Lastly, in some other news, I don't want to be ignoring this. Most of y'all have already heard that two of our providers in Hartsville, the Connors, as we call them, Dr. Connor and his wife, who was the nurse practitioner, have left our employment. We're sorry to hear this, but they had family up in Pennsylvania, and it was very important for them to get back up to and meet those family needs. So they are no longer with us. I don't know exactly what our recruitment plans are going to be around that. We've got to wrap our heads around what the needs are and see how we can meet that. But stay tuned. We'll try to keep you informed around that. Of course, as I have already reported to you, Dr. Cabrero has started in Dillon, and we're very excited to have her on board. That's a breath of fresh air for Dillon. Also, in other news, congratulations need to go out to Chris Lane. Dillon County had a best of contest, and Chris Lane in our Latta office won as best nurse practitioner throughout Dillon County. So kudos to Chris and kudos to his team for really pulling together and accomplishing this. That's a lot, folks. This is one of the longest videos I've had in a while. I hope you could hang in. I'll try my best to keep you informed and to let you know of updates. So stay tuned. Have a very good weekend. Don't wait, vaccinate, and stay safe, please. Bye bye.